Okay, good evening, everybody. I would like to thank as well the organizing committee for the kind invitation. And in the next few minutes, we're going to discuss a bit about these novel platforms. Now, we have the DES, and they're fine. They are safe, and they're effective. But there is an issue. When we place a classical DES, we jail the vessel and make full recovery of vasomotor and endothelial function a bit problematic. So what we aim to achieve with the new scaffolds was to have the short-term benefit of the DES and at the same time leave nothing behind in the long term. Despite the excitement, the initial excitement, the first broadly used such scaffold, the Absorb from Abbott, proved to be a little bit disappointing. First of all, because we had a lot of late lumen loss, and second, because we had almost 3 times higher incidence of possible or definite stent thrombosis. The mechanisms of failure is, there are basically 3 different mechanisms. First of all, there are mechanical limitations in these kind of scaffolds. They are biological materials, so the radial force is less. To be able to have a biological material and stretch it and crimp it without breaking is a bit more problematic, so we end up with thicker struts. And when we place this kind of scaffolds, then we have more turbulent flow in the vessel. Then we had issues with stent under expansion and malapposition that would cause acute stent or early stent thrombosis. And then at the phase of the resorption of the scaffolds, we had often issues with intraluminal dismantling, leading to late and very late stent thrombosis. Despite these limitations, these drawbacks, there were data from certain groups that showed that they had, even with the first generation BRS, they had comparable results with classical DES. For example, this on the right side, this registry from Germany and Switzerland, where they followed about 1,500 patients for more than a year. And when they used a dedicated protocol for placing BVS, they had almost comparable results with classical DES. And what was this? Was the so-called PSP concept. So optimal predilatation, appropriate sizing, and post-dilatation. Therefore, imaging is crucial when we handle this kind of scaffolds. It helps us avoid implantation of scaffolds in very small vessels. It helps us pick the appropriate sizing of the scaffold and avoid under-expansion and malapposition. Despite the initial disappointment from the Absorb scaffold, then there's still research on this topic. Biotronic presented the Magmaris, that was one of the most well-known follow-up scaffolds. Also quite thick in strut thickness, sirolimus eluting with magnesium alloy. The problem with this was that we had quite a lot of late lumen loss, both at 6 and 12 months. Then there is a newer generation, the FreeSolve. It's thinner struts, less than 100 micrometers. Also limus eluting, quite safe in terms of stent thrombosis and target lesion failure, and better than the Magmaris in terms of late lumen loss, and also almost comparable with the conventional drug-eluting stents. And then I would end up with this Dynamics bioadapter that was also mentioned by my colleague previously. It's indeed 70 micrometers cobalt chromium, basically platform. It's sirolimus eluting. As was shown previously, basically there are 3 helical strands that unlock at 6 months, and in this way we free the vessel, we can move freely after this period, and then the safety results up to 24 months are excellent. And we had also last year this the presentation on ESC of the Infinity Sweetheart, the trial, where 2,500 patients were randomized to this new platform compared to one of the best of the class classical drug-eluting stents, the Medtronic Onyx. At 1 year, we had similar target lesion failure, but if we check the period between 6 months and 12 months, it seems that the bioadapter platform seems to perform a little better than Medtronic. Now, if this is a indeed true, we have to check with larger series and a longer follow-up. Thank you.
So thank you so much. I think this was a great overview of what we have potentially in the pipeline, or just start using. Then perhaps there are other innovation they are coming, and this is opening the window to the last session, that is looking into the future.